Good day and Assalamualaikum warahmatullahi ta'ala wa barakatuhu. Greetings of peace. So today we will be discussing the Unit 4 of your Psychiatric Health Nursing or Mental Health Nursing, which talks about psychopharmacology. So psychopharmacology, so from the word psycho and pharmacology, this refers to the use of medication to treat mental disorders. These medications work by affecting neurotransmitters in the brain, which influences mood, behavior, and thinking. So again, medications. So definition of psychopharmacology, again, these are medications used to treat mental disorders by affecting the neurotransmitters in the brain. So again, let's review, diba? We have different neurotransmitters in the in the mnemonics DANGs. Dopamine, acetylcholine, norepinephrine and epinephrine, GABA or your gamma aminobutyric acid, and your serotonin. Okay. Now, the principles of psychotropic medication, or the goal of psychotropic medication, is to manage symptoms. Okay, so it is important to remember that psychotropic medications are used for symptom management and not a cure. These drugs, or most drugs, affect or mainly act on the synaptic cleft of the or space between the neurons through three mechanisms. So first is to inhibit reuptake. So when we say inhibit reuptake, it prolongs the action of neurotransmitters. So it keeps the neurotransmitters active longer. Okay. Now, blocking, it may block receptors, or what we call antagonists. So they prevent neurotransmitter effects. And lastly, they either stimulate receptors, or what we call agonists. So they enhances the neurotransmitter activity. So in simpler terms, this medication can either increase, decrease brain chemical activity to restore balance. So again, three mechanisms of psychotropic or pharmacology or psychomedications is inhibit reuptake, block receptors, and stimulate receptors. So now let's discuss the first pharmacology or psychomedication, okay, or a medication that used to treat psychological or psychiatric problems. Okay, so first is your antipsychotics, or known to be your neuroleptics. Okay, so antipsychotics are used to treat schizophrenia, psychosis, and acute mania, or psychotic symptoms. So they are classified into two, namely the first generation and second generation. So we have the typical, which is the first generation, and atypical, the second generation. So first generation is a strong dopamine blocker. So they are a primarily dopamine antagonist. So they blocks the actions of dopamine. Okay. So example, we have your chlorpromazine or haloperidol. While your second generation or your atypical antipsychotics, they affect both dopamine and serotonin. Then they are weaker dopamine blocker in compared to your typical antipsychotics. So again, they also affect or inhibit the serotonin reuptake. So examples of this atypical antipsychotics, risperidone, quetiapine, and quetiapine and clozapine. So atypical antipsychotics, okay, generally have fewer motor side effects. Okay, so side effect of antipsychotic drugs includes extrapyramidal symptoms, or EPS, and your NMS, which namely neuroleptic malignant syndrome, a potentially fatal reaction after taking antipsychotic drugs. So one of the most important responsibility of the nurses when giving antipsychotic drug is to monitor serious side effects, which is your pyramidal symptoms. So this includes acute dystonia or muscle stiffness or muscle rigidity, Parkinsonism, okay, shuffling gait and tremor. So with the word pseudo, which means just like a person having a Parkinson's disease, they also have tremors and shuffling gait. Now, another EPS is your akathisia, which means restlessness. So another part of your EPS is your tardive dyskinesia or involuntary movement like lip smacking. This is often irreversible. So again, example, your lip smacking and tongue protrusion. And your NMS, which is a potentially fatal reaction after taking antipsychotic medication, a medical emergency which may cause high fever, lead pipe rigidity, and autonomic instability. So when NMS or neuromalignant syndrome occurs, stop the medication immediately and seek immediate medical attention. So again, if you are giving antipsychotic drugs or if the patient takes antipsychotic drugs at home, it is very, very important to discuss this EPS and to alert the patient alert the patient about this one and tell them to go to the nearest hospital to be treated if this occurs. Okay, so again, if the serious side effects happen, stop the medication and immediately seek medical attention. So another medication after these antipsychotic or neuroleptics, we have your antidepressants. So from the word antidepressants, this causes to block the depression symptoms. Okay, so these are used for major depression or depressive disorder or your depression, your anxiety, or your OCD or obsessive compulsive disorder. So there are primary or main classes of this medication. We have your SSRI or selective serotonin reuptake inhibitors. We have SNRIs, and we have your TCAs, and we have your MAOIs. Okay. So your SSRI or selective selective serotonin reuptake inhibitors are the first line treatment for your depression. Okay, so bakit or why they are the first first line? Because they have fewer side effects. Okay. Now your SNRI or your serotonin norepinephrine reuptake inhibitors, okay, they work by blocking the reuptake of two neurotransmitters, namely the serotonin and your norepinephrine. Okay. So, this means that more of these chemicals remain in the brain, helping improve mood and energy levels. So, example, we have venlafaxine. So, again, it increases the norepinephrine and your serotonin. This is used for depression, anxiety disorders, and sometimes chronic pain. Now, for your TCAs or what we call tricyclic antidepressants, again, TCAs, again, tricyclic antidepressants. These are one of the older classes of antidepressants. So, this is an older class. They have higher risk of cardiac toxicity. That's why you have to be careful in giving this medication. This is effective but not first line due to safety concerns. They affect multiple receptors, not just your serotonin and norepinephrine. Okay? There are also other receptors that is affected by your tricyclic antidepressant. So, however, they are less selective. No? That's why they lead to more side effects. So again, the reason why we don't use, or as much as possible, we don't use the TCAs as a first line treatment for antidepressant because they have much more side effects, except for in comparison with your SSRI or selective serotonin reuptake reuptake inhibitors. Now, for your MAOI, when you say MAOI, monoamine oxidase inhibitors, again, monoamine oxidase inhibitors, they work by blocking the enzyme monoamine oxidase, which breaks down neurotransmitters like your serotonin, norepinephrine, and dopamine. Again, this works by blocking the monoamine, the enzyme. So they block that, not directly the neurotransmitter itself that they block. Unlike the TCAs, the SSRI and SNRI, they specifically block the reuptake of a certain neurotransmitter. Your MAOI, or your monoamine oxidase inhibitors, they block an enzyme called monoamine oxidase, which means when you block this enzyme, this breaks down the neurotransmitters like the serotonin, norepinephrine, and dopamine. Therefore, this results in an increased level of this neurotransmitter, which causes, meaning if it breaks down the serotonin, norepinephrine, dopamine, it increases the level of this neurotransmitter. So this is very effective but really used today. This is reserved for patients who do not respond to other treatments. So if they don't respond from SSRI, SNRI, and TCAs, this is the last medication you can give to that person. Okay. However, there is a major risk for this medication. Okay. Your MAOI, okay, a patient who eats food high in tyramine, so high food in tyramine, such as aged cheese, processed meats, and fermented foods, can experience hypertensive crisis. So this can cause a severe high blood pressure, a stroke, and even death to the patient. That is why you have to strictly educate the patient on their diet when they are taking MAOIs. They have to avoid any drug interactions, especially with other antidepressants. So they should not be taken with other antidepressants such as SNRI, SSRI, or TCAs. And monitor blood pressure regularly. Okay? So, now let's talk about mood stabilizing agents. Okay. Your mood stabilizing agents is usually indicated for patients having bipolar disorders. So, mood stabilizing, okay, or mood stabilizers, these are mainly used for bipolar or those who has usually or especially in manic episodes of your bipolar. So remember, your bipolar is your manic depression, okay, or depression manic. So the gold standard of your mood stabilizer is the lithium, okay? So lithium, however, requires a strict blood level monitoring. So this has, we have the therapeutic range of your lithium, which is your 0.6 to 1.2. If it's higher than 1.5 milliequivalent per liter, it means it is toxic to the patient. So you have to stop the medication. So signs of toxicity of the lithium may include severe diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination. So the nursing note, okay, or nursing responsibility, ensure the patient takes or maintains consistent salt and fluid intake. Why? Because dehydration can increase lithium toxicity. So, we have to avoid dehydration, or the patient may experience dehydration. We have to avoid that one when they are taking mood stabilizers, especially your lithium. So, other mood stabilizers may include your valproic acid, or your anticonvulsants, and we have also your carbamazepine. Okay, so these are different anticonvulsants that may be used as mood stabilizer. Again, this is usually given for bipolar patients, especially if they are in manic state or manic episodes. Now let's talk about anxiolytics and sedative hypnotics. So anxiolytics, from the word anxiolytics, meaning these are medication usually or indicated for patient experiencing anxiety, okay, insomnia, alcohol withdrawal. So we have different anxiolytics. It may be a benzodiazepines or benzodiazepines and non-benzodiazepines or non-benzodiazepines. Now, benzodiazepines is fast-acting but it has high risk for physical dependence and tolerance. So we have to monitor the patient not to be or avoid the patient to be dependent on this medication. So example, we have diazepam, lorazepam, and alprazolam. So again, these are fast-acting for panic attacks. However, they have high potential for abuse or dependence, and this may cause sedation. Okay, so you have to monitor the loss of consciousness, or a level of consciousness of patients taking this type of medication. Now, for non-benzodiazepines, we have buspirone. Okay, this is very effective for chronic anxiety without the high or dependency risk. So it takes 2 to 4 weeks to work. So it's not fast acting, not like the benzodiazepines. Yes, they are fast acting, but there is a high risk for dependence. While your non-benzo, it takes 2 to 4 weeks to work, and it has low or no dependence risk. So nursing responsibilities and patient safety for patients taking this different medication, namely let's review. We have your antipsychotics or your neuroleptics, your anxiolytics, your antidepressants, your mood stabilizers, and sedative hypnotics. So the nursing responsibilities and patient safety for patients taking this type of medications is first, always check for baseline vitals and lab results, especially your liver enzymes and kidney function. Okay? For patient education, the medication may take 4 to 6 weeks to work. Not all are fast acting, so you have to be patient. Manage side effects such as your dry mouth and constipation. This is also known as your anticholinergic effects. Okay? Provide safety measure for those patients who experience orthostatic hypotension. So you advise the patient to rise slowly. Avoid alcohol, beverages, and OTC or over-the-counter drugs, and even herbal supplements like St. John's wort, okay, when taking medications like this. And never stop medications abruptly. Just because you feel better, you will stop it, or just because you don't like the side effects, except for extrapyramidal symptoms, okay, your EPS or your side effects, the EPS, you have to stop the medication. However, any side effects of medications na you're not happy with it, so you have to visit first the physician to be advised not to take the medication or to change the medication. Okay, so it may cause a risk of rebound symptoms. Now, for adherence, you have to discuss side effects openly to prevent patients from discontinuing treatment. Okay? Encourage or educate patients about the side effects and encourage continuation of medication despite the delayed effects. Because, again, this type of medication, some of the medications that treat psychiatric disorders or psychiatric illness or mental illnesses takes time to take effect. So you have to be consistent, you have to be patient to wait for it to work. Okay? So in summary, psychopharmacology, okay, is essential in managing mental health conditions. As nurses, our responsibilities when in psychopharmacology is to monitor the drug effects, again, especially those adverse effect or undesirable side effects of medications, recognizing adverse reactions, educating patients, promoting medication adherence. In psychopharmacology, adherence is very important because not all medications are fast acting. So understanding these medications help us provide safe, effective, and holistic care. Okay? So again, thank you for watching this video. If you have any clarifications, any questions about the things that I have discussed here in this video, do not hesitate to leave a comment with this video. So thank you for watching and have a nice day.